Hi, I'm Gary Bebow, CEO of Weber Health System, and this is my monthly CEO Connection. I'm really pleased today to have Drs. Hunter Brown and Rob Emery with me. There's two urologists on the staff who've really been a terrific additions to our staff and great members and did such great work for us in our community. Last October, Drs. Emery and Brown became employed. Prior to that, they were independent practitioners, and I thought just to get started is, tell me a little bit about you guys. How's it been going since you've become employed, and anything that, what's been the difference, really, frankly, between what it was before and what it is now?
Well, it's, I think we feel more part of the medical community being employed. We're kind of more connected, and it was really becoming difficult to be in private practice with all the government regulations and all the different insurance regulations, and I think it gives us an opportunity just to get back to where we take care of patients, which is what we're good at and what we like to do. And we turn all the bureaucracy over to you, and you're good at that, so it's kind of the best of both worlds, I think.
Hunter, you know, when I started in January of 1991, you were freshly here as well. I think you started like the July before, so finishing your residency. So
sure did.
You've been with us for, 26 years now. I bet you've seen a lot of changes over that period of time.
Quite a few. You know, medicine's just become more of a business than anything else, and being able to deal with that has become more difficult through the years. It sure has.
Well, you've sure treated a lot of patients between the two of you guys over the years. You know, one thing these guys have done too that really has made White River Medical Center successful is that y'all not just stayed in base, but you've traveled to other clinics and other locations to treat people really at their place rather than always requiring them to come to base on it. That's really made a big impact on this hospital's growth, and so we really appreciate everything y'all have done for us. On September 20th, we're going to do our annual prostate screening, and these two guys are the mainstays of the screening program. And tell me a little bit about that. I think earlier y'all said we've been doing it for almost 20 years now, and tell me a little bit about the prostate screening. You know, there's been some controversy about the PSA testing and all that stuff. What's your all's take about that in the program that we're going to be involved in?
Well, we do this every year, and like you said, we've done it since 1998, and you know, it gives an opportunity for men who may not have the ability or the access to medical care to come in, get blood work to screen for prostate cancer, as well as a physical examination. You know, a lot of screening is just blood work and so forth, but we actually examine them, and really, I think we usually average right at 300 a year, which is honestly, it's the biggest screening in the state, according to the Arkansas Prostate Cancer Foundation. They actually have come up the last few years because they like to model ours in other places. And it's a good environment. There's a lot of people from the hospital volunteer to come draw blood and help guys get down the right line and get everything organized. And we have a couple other physicians, Dr. Allgood and Dr. Kahn from the oncology side come and help us out as well.
Dr. Desikan does too, doesn't he?
He's done it in the past as well. And I think we have a nurse practitioner.
Will Moore, Will Moore does. Well, having been a participant in this fine program over the past, it really runs well.
And we typically will pick up anywhere from a half to a dozen men with prostate cancer.
So that's from 5 to 8 o'clock p.m. on September the 20th. And so if an individual wanted to sign up for it, they contact our marketing department, and so it'll be a busy night and one that's a great community service. We really appreciate you guys participating in that again this year as you have in the past, and really appreciate you being here today with me. So thank you.
And if you're coming, don't be afraid of a long line because it moves very quickly.
Sure does.
They're well organized.
People are usually, you're probably not there more than 20 minutes, 30 minutes tops, and in and out and done. So
some other things I might bring you all up to date on in terms of urology is, starting this September, Dr. Emery will also be seeing patients at the Newport Diagnostic Medical Clinic. And also, Carla Smith, Dr. Emery's APRN, is now providing urology services in the Mountain View and Stone County Medical Center. You know, every month we do a community education program, and on September 13th, Dr. Emery is going to be talking about kidney stones. And Doc, what do you plan on telling everybody about?
Well, it's to drink more water. That's the number one thing. But you know, kidney stones affect 50% of Americans, and it unfortunately keeps us in business. And we had an extremely busy summer with kidney stones. It was a really busy summer, and summer is the worst time for stones. So we're going to talk about some of that and ways we treat it, what's available, and then also ways to maybe try to prevent them, and you know, try to keep them to a minimum anyway.
You know, over the last year or so, gosh, we've probably been doing this for 3 or 4 years, I guess, but over the last year or so, I have really noticed a big attendance in the community health education programs, and so it turned out to be really a great community service. So I know that yours will be very well attended too. So thank you for doing that.
You bet.
In addition to the community health education event, we'll also have a children's clinic glow ride, which will be on September 10th at 7:00 p.m. It'll be held at the WRHS walking track, and so if you're interested in that, be sure to call our children's clinic and come and participate in the glow ride. On October 4th, our annual Health First Women's Health Expo, it will be held at UACCB. As in the past, we'll do that jointly with First Community Bank, and I'm sure that we'll have great attendance. And so from 4 to 7 o'clock on October the 4th, if you're available, come on out to UACCB and participate in the Health First event. Each month we recognize employees for their contribution to the hospital, and for Stone County Medical Center, Robin Stone, an RN, has been recognized as their Employee of the Month. Robin's been with us for about 5 years, and by all record, she's really well deserving of this recognition. So be sure to do that at Stone County Medical Center. At Waiver Medical Center, Lisa Brown from Environmental Services has been chosen for environmental focus. Lisa's been employed here for 10 years, really high-performing employee, and gosh, all of us really owe a great deal of gratitude to the employee services for how well they keep our facilities up to date, and how clean they are, and Lisa's a real leader in that department, so congratulations to Lisa. On a different topic, the internal medicine residency program is on schedule to begin in July of 2017. So we have filed our application. It's been received. We'll be having a site visit on August 30th, and everything's going just as planned. We anticipate going through the site visit and passing that without any problems. That will allow us to go through the match for physicians and doctors of osteopathy and the medical doctors, and so we'll be interviewing those physicians sometime beginning of next year with a plan that we'll have up to 10 doctors in training in internal medicine beginning next year. So Dr. Kasawi and Dr. Norton and Jody Smotherman have been very involved and done a terrific job getting us to where we are today, and so we're on schedule to really offer a great new service to this part of the state. As you know, we've had a lot of construction activity going on, and October just turns out to be a month where a lot of things get completed. For example, at our emergency room project, which has really been going on since December of last year, we're on schedule to have that emergency room project completed and have all the dust settling after that. So I know many of you have been very much inconvenienced during this last 10 months, and I want you to know that we're on schedule, and we're going to have a great new emergency room come the end of October. In addition, the Southside project across from the airport is on schedule to be completed in October. We were real fortunate that Life Plus donated the property in the facility that we are in the process of renovating, and Dr. Shannon Swift and Dr. Parker, Dr. Parker will be joining us in December. They'll both be practicing out there, and there's no doubt that satellite clinic in Southside will really be a good addition for the health care in that area. In Newport, we're underway with completing the Newport clinic. Again, finishing sometime near the late part of October. The project will take us from about 9,000 square feet over in Newport to almost 37,000 square feet. So not only will we have the medical clinic that's currently being manned by Doctors Lawson and Hunt, we'll also have, into the new facility, we'll have an urgent care center, we'll have a specialty clinic where doctors from White River Medical Center will see patients in Newport. We'll have a pain management clinic. We will have a MRI and x-ray services. We'll have cardiac rehab in that facility. In addition, we've been successful in having Attention Home Supply that will be providing DME services or products, and also we'll have a pharmacy, Norman and Baker, that will be located at that site. So we'll have a very vibrant new program over there. So again, end of October. And finally, we'll be completing in October the expansion of our adult psych unit. Currently, well, we started doing adult psych in January of 2015, and so a year and a half later, we're at a point where we really feel like we can double the size from 12 to 24 beds. Our internal construction staff have really done a super job of renovating the new space, and so we're looking forward in October to basically double our capacity and better have access for patients in need of mental health care in this area. The new unit is an extension of a stepping stone, and so I'm really proud of the work that they're doing up there, and I look forward to that expansion of capabilities. That concludes my CEO connection. As usual, if you have any suggestions on how I can do this better or topics you'd like to see me address in the future, be sure to let us know. So have a great month.